7 months ago, Sioux Falls experienced its first positive case of COVID-19. Since then, our community, as well with others in the nation and across the globe, have faced challenges in how to best fight not only the virus, but also the far-reaching implications of the virus and its effects on mental health, healthcare industry, economic vitality, business, workforce, education, nearly every facet of our community. In preparing for and responding to the COVID-19 virus, I, along with many other community, state, and federal leaders, we've diligently communicated to you that mitigation efforts, including physical distancing, hand washing, respiratory hygiene, and the use of facial coverings, would play a critical role in decreasing the transmission of this disease. And this obviously remains very true today. I, as the mayor of Sioux Falls, am relying and expecting each of you in this community to do your part and utilize these mitigation efforts to help our community fight this disease. We're not powerless, though, in the face of COVID-19 here. As a state, the state has taken a personal responsibility approach and has thus far refrained from broad government mandates in our efforts to manage the virus. And that also remains true today. In addition, since the beginning of the pandemic, our goal in Sioux Falls has been to flatten the curve and ensure that our community's hospitals have the capacity to treat both COVID and non-COVID-19 patients. Let me remind everyone of that. That's been our goal all along, and that goal has not changed. Ensuring healthcare capacity is there for those who may need it is the primary objective in our fight against COVID-19. Due to the responsibility of each of you as residents and business owners, we have seen those initial curve projections flatten tremendously. Today, we are seeing increases in cases across our region. And as with many hospitals across the region, our healthcare systems are experiencing increased but manageable demand. You're going to hear from representatives from Avera and Sanford briefly. Communication with both systems remains of key importance to me. Communicate regularly with both the administrators of our large healthcare partners, but also those with their boots on the ground at the clinical level, including the chief medical officers of both organizations. They have been able to share great information on their census data, bed capacity, patient origin data, all important things that we'll be using as we continue to mitigate our fight against COVID-19. But today specifically, I'm going to be asking for enhanced diligence in this community, and specifically on the topic of face coverings. Effective today, the City of Sioux Falls, as an employer, and our 1,300 employees will be required to wear masks in all common areas, all interactions with the public, all areas where distancing simply is not possible. I consider myself the chief executive of one of Sioux Falls' largest employers, and that's a step that I can take to ensure our critical workforce remains healthy while also protecting the residents around them. I'm asking other businesses not only in this city, but in this region, to consider doing similar measures to help slow our spread. You will not see my administration mandating any mask wearing requirements at this time. I will continue to rely on personal decision making, both by individuals, but as well as businesses and employers who have a responsibility as well. I will say, however, that as we move through this current case surge, we each need to do our part to manage COVID-19. I'm also requesting that people that are listening today take care of their own mental health. That continues to be a big challenge in the fight against COVID-19 right now. Make an effort to take care of your physical health, your own mental well-being, control your environmental surroundings, control the information that you're taking in. Despite the current challenges of the pandemic, we have so much to be grateful for still in this community and how resilient we've been to date. And it's vitally important to our overall health and well-being that we remember this. So moving forward, effective today, we will have bi-weekly COVID-19 updates at this time, 1:30 on Mondays. And we'll use that time, whether we have new data to share or not, to answer any questions and talk about how this region and community is doing in our fight against COVID-19. Finally, as a reminder, you can always contact my office directly with any questions, comments, concerns that you have. mayor@siouxfalls.org is a great email address to do that. Next, I'd like to invite up some representatives from our healthcare partners at both Avera and Sanford, and I first want to welcome Dave Fleechek. Dave's the president and CEO of Avera McKennan Hospital. Dave?
All right, hey, thanks, Mayor. First, I want to give a shout out to all our healthcare workers. Our healthcare workers across multiple clinical settings, in the nursing homes, in the hospitals, in the clinics. It's a long day in a PPE equipment, and frontline nurses and doctors are working really hard in a very tense and somewhat rewarding time, I would say, as well. So just want to give a shout out to all our healthcare workers. Second, I want to give a shout out to the mayor and the staff, Jill. It's a pleasure doing business with you. The governor and her staff. Only in South Dakota can you call someone up, and in South Dakota they return a call. And I'm just telling you, that's heartwarming, given all of the logistics that we're trying to manage here with testing, making sure we have capacity, ICU, and it's just nice to know that we have a lot of really good people willing to work together, including the other systems, Sanford, Monument, Avera. We're in contact every day together to try to maximize our capacity and make sure we're working together through this pandemic. I'd also say we've learned a lot since March. We have learned a lot. At Avera, 60% of the COVID patients are now being taken care of outside Sioux Falls. And I can tell you in March, they all used to come to Sioux Falls. So we've really had a ability to treat patients now in our regional centers, Aberdeen, Mitchell, Yankton, Watertown, Brookings. And so that's something we should lift up as well, is that Avera McKennan is only taking care of 40% of the COVID patients. While we have seen some increases in COVID, we've also seen probably a greater increase in delayed care. And so our hospitals are busy, both of us would say that. But honestly, our ICU, of our COVID patients at Avera McKennan Hospital right now, only 15% of them are COVID. 85% are delayed care or regular routine care or surgeries, sick people. Our ICUs did reach a capacity of 75% this past week, and in the ICUs, only 30% are COVID. So right now, this is all very manageable. We're okay with where we're at right now. What we plan on doing, though, we had a trigger point where we said at 75%, we want to now get ready for the influenza season. So we're going to create 12 new ICU beds, so we thought that would be prudent planning on our part to get ready for the winter. So that is going to go and work, so our employees are working on that right now. Also, we are working on 24 to 34 more surge beds, med surge beds. And that's something that we're also working on that should have in place through November. So again, this is about being proactive, about managing this disease. But I got to tell you, it does come down to there's no vaccine yet. And so to echo what the mayor said, all of us from our workforce perspective, I have a couple hundred people who are out quarantined. And it was probably happened outside of work. So I would just encourage all of us to continue to wear our mask, continue to wash our hands and social distance. That's how we can at least flatten the curve here. And I think as a workforce perspective, it's really about workforce and keeping people, parents and their kids in school. So just let's do the right thing and continue to wear our mask going forward. So it's been, we're in a really good spot. I think we're pre-planning, we're getting in front of this, and so at this point, it's manageable. So thank you. I'd now like to introduce Dr. Mike Wilde to give a few remarks from Sanford.
Thanks, Dave, and thanks to the mayor as well, and good afternoon. So as a representative of Sanford, and as I discussed with many of you last week as well, and getting the message out, we also are seeing a lot of patients, which is pretty typical for this time of year, as I've gone back through my own clinical history, but also just working in the role I'm currently in. Typically when schools open up and people are busy, personally, now we're at a time where summer vacations are over, kids are back in school, people maybe prioritize some healthcare decisions at this time of year. And so we traditionally tend to be a little busier this time of year. We, of course, are also seeing an increased need for COVID care. And as Dave alluded to, and I think makes a good point regarding some delayed care as well. And so certainly seeing more patients at this time currently. We monitor our supplies on a daily basis and are doing fine from that standpoint. And we certainly work with our capacity on a daily basis, not only in Sioux Falls, but in our outlying facilities as well. And the folks out there are doing really nice work in regard to prioritizing care for those patients to get the best care as close to home as possible, where they're the most comfortable. And so would also like to lift up the staff at Sanford, both in Sioux Falls and throughout our network, who are working really hard, very tirelessly at this time, really committed to safe, quality patient care. We're in close communication, like I alluded to, with our network facilities to see how they're doing, and then to move patients properly as needs are determined. Work very closely with our partners in the city and partners within Avera. I know just over the weekend there was communication between nursing and physician leaders as to how we're doing and how we can best accommodate patients, and also working very closely with the city in real-time communication and asking how they're doing and vice versa. In terms of caring for COVID patients that are presenting to Sanford, we really rely on the expertise of the frontline physicians, nurses, pharmacists, etc. We do have weekly calls with our intensive care unit physicians across all of Sanford to really share best practices and evolve the practice of COVID. Keeping in mind that this was not recognized until last December, and that those learnings internationally have continued to flow nationally and now locally as well. And so we really tap into our expertise at Sanford to share those best practices and learnings. We're also working closely with our network facilities and Sioux Falls facilities to be in real-time communication, really lifting up those best practices for caring for COVID patients. With this, we've been able to evolve to the point where less than 15% of patients needing ICU care are on a ventilator at this time, and that's been a tradition across all of Sanford. And what we're seeing currently is about 10 to 15% of patients at Sanford tend to be from the Sioux Falls area. Otherwise, we're really seeing this illness, unfortunately, get into our smaller communities as well. And I think that I really want to conclude with what the mayor and Dave alluded to as well, and those infection prevention practices. So as we saw in the spring, this illness was really more common in Sioux Falls, perhaps Rapid City, and a few outlying areas as well. Now it's really ubiquitous across all of our communities. And I think people are, not that they weren't paying attention before, we're really starting to pay more attention. And I think it's important to lift up some of the learnings that we see from the CDC and other experts as well. This is a droplet infection, and so it is spread by contaminated droplets getting on surfaces or directly if you're close enough to someone, and you can pick up the infection. And that's why it's important to, number one, stay home if you're ill, stay 6 feet apart, but then also consider things like where your hands are and common touch surfaces, and that hand hygiene is very important. Masking is a part of that solution as well. And I think there's a lot of focus on masks, but masks are really part of the solution. There's data out there both supporting and saying kind of neutral things about masking. We just don't know yet. And so we really can't make a recommendation outside of what the CDC is recommending, and it really fits in that broad scheme of all the things you need to do to mitigate the spread of this illness. I would just like to conclude with just encouraging people to be really thoughtful about social gatherings and their settings. And from my standpoint, know who you're coming in contact with. And by that I mean, know your family situation and who's at risk. We're certainly seeing more of an active or serious infection from COVID in the setting of folks who are older, obese, other medical conditions as well. So if you're in a housing situation where you're in close contact with people who are at higher risk for hospitalization or more severe illness, I'd highly recommend being very thoughtful about, are you going to go to community gatherings, family gatherings, things like that? What steps are you going to take to not pick up this infection? And then if you're around that loved one that maybe has some medical issues, what are you going to do to prevent that spread? And be very thoughtful in that regard. With that, I'd like to turn it over to Jill for some concluding remarks.
Good afternoon, everyone. After hearing Mayor Paul and our health system leadership speak on this topic, I'd just like to share a little graphical representation of what we've got going on in our community. I hope you're able to see this well enough, but in the upper left-hand corner is our total active cases. And these are people that have the potential to spread the illness in our community. And this, you can see, has been steadily and actually somewhat, significantly increasing over the last couple of weeks. Our total new daily cases, which is in the upper right-hand corner here, has been showing a slightly lower rate of increasing, but it's been so volatile. And so you can see we have had days that have been quite significant coupled with, but overall the trending is moving in an upward direction. But really importantly is what we've been talking about in this press conference, and that is hospitalizations, and that's in the lower right corner. And you can see a pretty significant increase. And if you look prior to this time period, you will see that has actually really increased over the last couple of weeks from prior. And you can have access to this anytime, every single day, by going on to siouxfalls.org /COVID-19, and I really invite the public to please do so to stay informed as to how we're doing as a community. So then this next slide provides us with kind of a timeline of where we've been at with COVID, and you can see in this time period here, starting about August, we saw again some volatility, but we are really starting to see an increase across both of our counties, both Minnehaha and Lincoln County. And especially Lincoln County, we're really starting to see some increases that we hadn't seen for quite a while in the early stages of COVID in our community. So that's important as well for us to pay attention to. Bottom line, we've got to reverse these trends. Mitigating the spread of this virus and being able to get a handle on this is really, it's the essence of public health. It's the public's responsibility to do what we need to do to reverse this trend and to mitigate the spread of this virus. You've heard each and every one of us talk about those things that we need to do. We have got to be able to make sure we're physically distancing with each other. We've got to practice good respiratory hygiene. If you are sick, stay home and isolate yourself so that you do not spread this virus or any other infections to other people. And if you're in a situation where you cannot physically distance, you must wear a mask. I really cannot stress that enough right now. Every time I leave home, I'm going to just give you this little, example. Every time I leave my office or my home, I make sure I have hand sanitizer, I make sure I have tissue, and I make sure I have my mask. I'm asking each of you to do the same. Until we have a vaccine, this is our best defense, everyone, from being able to make sure that we mitigate the spread of this virus. In addition, we're continuing to work really closely with our partners. We're continuing to increase communications with our health system partners, our other partners across the community. We're continuing to evaluate, as you heard from Mayor Paul, the things that we're doing within our own city to make sure we mitigate the spread of this virus. And we're looking at the other things that we need to make sure we're doing, such as making sure that people who cannot isolate or quarantine effectively in their own dwelling have a place to do so. So those are some of the few things that we're doing right now to really increase our response to this virus. To wrap up my remarks, I'm really asking you all to do your part. It really is upon each of us, each and every one of us, to make sure that I'm protecting you and you are protecting me. That's what we do as a society. That's how we do this work as a public together to mitigate a virus that's in our community and really is threatening us.